Hi, Bruins. My name is Drea Letamendi, and I'm a psychologist in residential life and the interim director of the UCLA Student Resilience Center called RISE. With these wellness messages, I'm sharing ways that you can reflect and make real changes related to your emotional and social well-being. By this time, we're experiencing how the coronavirus pandemic has introduced changes to our lifestyles, expectations, and how we feel about ourselves and our futures. Today, though, I want to ask you to focus your attention on how you feel about your situation right now. Words like safe at home and safer at home may strike a different emotion in some students who aren't in the safest place when they're quarantining and away from the sanctuary of campus, the communities that validate and value them, and the mentors who accept them wholly. Psychological safety refers to your ability to be safe with oneself and to rely on your ability to shield yourself against any destructive impulses deriving from other people. It means having a sense of internal authority that is fair and non-abusive. It means keeping yourself out of harm's way. It means protection. Trauma, in the form of interpersonal assault, aggression, and hostility, can rob you of these opportunities and prevent the development of a clear and integrated sense of self. Accessing support is crucial. How can you get access to services that you really need in terms of experiencing these challenges? I spoke to Jennifer Jarius of the CARE program at UCLA about how we can achieve safe environments during the COVID crisis.
Hi, this is Jennifer Jarius, the CARE program director. CARE is the Campus Assault Resources and Education program at UCLA, and we serve students, staff, faculty, basically the entire UCLA community.
As students are managing their health and safety and quarantining at home, what are some barriers that they might encounter?
I think some of the challenges that our CARE folks are seeing as they transition to social distancing and remote learning and the off-campus aspect that's happening currently really are lack of access to privacy and space in order to access our types of services, which are confidential, private, supportive services. In addition to things like CAPS and mental health treatment, it's really challenging when you're quarantining with folks to find the space and the access to get those services that you really need.
What if some students feel that they don't have someone at home that they can speak to authentically and with safety?
For some folks, if they're dealing with some really challenging issues like trauma from a lot of the things that we see, sexual assault, violence, intimate partner violence, there are many folks in their life that they don't want to talk to them about this, and so they don't want them to know that they're getting services, so they can't safely access their sessions at home or wherever they're quarantining. Additionally, intimate partner violence is really challenging in times like this because you might be quarantined with an unsafe person, and so you don't know when you're going to be able to really leave and get the things that you need and to get to a safer place when we're in a stay-at-home order. There are some ways to still be safe though, and that we really look at, on an individual basis in terms of safety planning and really creating resources for yourself. So, a lot of our advocates, a lot of our work is showing folks how to create a safety plan that works for them. I think the really important thing that I want folks to know is that you're not in this alone. CARE services are still available right now. Now more than ever, we're available to help folks in whatever way we can, whether it's with housing resources or financial resources.
Thank you, Jennifer.
Thank you.
CARE is committed to the eradication of sexual and gender-based violence through creating and sustaining a safe, healthy, and equitable community for all people. CARE strives to help you achieve safety through provision of comprehensive prevention education, individual support and advocacy, and holistic healing programs. CARE remains engaged with campus, local, state, and national agencies as information related to COVID-19 continues to evolve. CARE is still connected with clients, and you can request an appointment by going to careprogram.ucla.edu. You can also email advocate@careprogram.ucla.edu to make an appointment. Finally, the CARE 24-hour crisis counseling line is available by calling 1-800-200-6665. For our students who rely on their residence halls, campus spaces, and classrooms for sanctuary and security, We see you, our hearts are with you, and we're thinking of you every single day. Please consider visiting the RISE website at risecenter.ucla.edu to watch our welcome video and the meditation specific to UCLA students who may not feel safe at home during this unprecedented time amidst COVID-19. In partnership with the LGBTQ Center, many campus voices have provided encouraging messages of hope. Most importantly, we want to remind you that you're not alone. For more wellness tips like this one, follow at RISE Center UCLA on Facebook and Instagram and UCLA_RISE on Twitter. We're in this together, and remember, no matter where you are in the world, you're still a Bruin. Be well.